Hi, Chip. Yes, Rev. You are on mute.
How are you?
I'm okay. Yes, now I can hear you.
Yeah, well, I'm doing very well.
Yes.
I've just used my phone first before I go into my laptop because I don't want to get myself into the delay that I had last time. How are you doing?
Okay. I'm okay. I'm doing well.
Okay.
Yes, we are happy for today.
Yeah.
Thank you for accepting to be a presenter as well. Um, I have your slides, so
Yeah, I want
you
you
can try
to.
if you will join. Okay.
No, yeah, no, I want you to be the one rolling it over for me
Projected.
to. Yeah.
Okay. Okay, that's fine. Okay, I will once the session starts, let me just try for a minute. That's the right one, correct?
Yeah, that is the right one.
Okay. Okay, I'll start sharing once people are
Yeah,
in.
when we are when the time is up.
Yeah, sure.
We still have like should be 19 minutes, something like that.
Yes.
Mm.
Okay, so actually forgot to mention, Pamela got an emergency.
Okay.
She won't be moderating, but she had actually asked one he's called the chaplain for KNH. He's called Mr. Kani. So he will be moderating. He should be joining us in the next few minutes.
Okay.
Okay.
Lete kwa birika ndogo hiyo chupa hiyo, weka kwa hiyo chupa.
Hi, everyone. Thank you for joining this particular webinar and joining on time. Allow me just a few minutes. We will be starting in the next 3 or so minutes. Yeah, kindly.
Wherever you are joining
Hi,
us
Mr.
from.
Hi.
Am I audible?
Yes, you are. You can continue. Thanks.
Thank you so much. I appreciate. Sorry, we delayed our meeting with a few minutes as we try to fix the technology, but I'm happy to invite all of us to our tonight's webinar. And, my name is John Kanyi from Kenyatta National Hospital. I work as a clinical chaplain, and I trust that we are keeping well, and I want to welcome each one of you to today's webinar. It's a continuous series. We had this last month, and so we are continuing on the same subject on spiritual assessment among children with palliative care needs. And our coming together, I believe, is to explore this sensitive and yet very crucial topic. We are reminded of the profound impact that spiritual care can have on the well-being of children living with palliative care needs. So our goal for interaction today is to deepen our understanding, share insights, and equip ourselves with the tools necessary to provide this compassionate, holistic care to children. And we have a distinguished expert with us who is going to be guiding our discussion and offer those valuable perspectives on this very crucial subject. I ask that we'll be putting our questions on the chat, and at the end of the presentation, we will be able to respond to that. So I feel welcome. Our speaker of today Allow me to call him Reverend Melly, who did the first part of this presentation last month. He's a reverend, an ordained minister, married with 4 children, and he's a religious and spiritual care chaplain, a counseling psychological practitioner, and life coach. He's equipped with the capacity to offer an interdisciplinary approach to the psychosocial, spiritual aspects of human-centered care in both ecclesial and non-ecclesial settings. He's a licensed African Inland Church Kenya pastor and an ordained minister by the National Association of Christian Ministers in the USA. His area of study and specialization is intercultural engagement of scripture and culture, with a focus on spiritual formation and the integration of spirituality in the development of holistic care leaders and professionals in both ecclesial and non-ecclesial settings. And so you can bet that it will be an interesting conversation. And I would want, without far much ado, to invite Reverend Mary to pick it up from there.
Thank you, Chaplain Kanyi. Did I get it right?
Yes, you did.
Yeah. Thank you because of the gracious introduction. I call myself a padding expert in this area. Not as you put it, but there is no problem. I appreciate. Last time I know most people do know me so far, and even those who have had opportunity to attend Kehpca meetings in Eldoret, they have once in a while met me. And now that this is my second time with you or through a webinar, I know I am no longer a stranger, but I'm now a friend and a partner in this journey. So before starting, I just remember today the story of Jesus asking his disciples to let the children come to him. And in my thinking, I think the world generally do not take seriously the needs for children. That is why you see in the story of Jesus and the disciples felt that the children were not part of the ministry that Jesus was doing on earth. But Jesus brought children to be at the center. And even in healthcare setting, pediatric care is becoming an important plank of our medical or healthcare systems. And so bringing in spirituality and childhood in the discussion of children is also an integral part of the whole discussion about spiritual assessment and pediatric palliative care. So I thought to begin with that statement. I want to begin with a story, a recent story with a certain child who had come to the hospital, and the name of the child is Trevor. That is not his real name. Trevor is an 8-year-old child who had come with a recent leukemia diagnosis. He was having a hard day, and his nurse asked me to see him. I walked into the room, looked at him, and said, "How are you, Trevor?" He nodded, and I explained I was the chaplain, greeting his dad and at the same time. "Have you ever met a chaplain before?" That was my question. "Or do you know what that is?" He shook his head, "No." I asked if he had ever met a pastor or a minister before, and he said yes, his eyes brightening a little. "Well, I'm like a pastor, but instead of working at a church, I work here at the hospital. I listen to people, talk to people. Sometimes I even pray with people." "Do you ever pray at home?" That was my question. "Oh, yes. Trevor said, I just talked to God the other day, and I told him it was fair that was it fair that I am sick? That was the response from Trevor. It's not fair, I agreed. But Trevor said, but God told me that he had picked me because I'm strong and I can get better. Trevor said. He said, it really wouldn't be fair to make another kid get sick who couldn't get better. That makes sense, I said. And our conversation continued. Talked a little about God, a little about Iron Man, and a little about the Achille kids in TV Citizen. Toward the end of the visit, having confirmed that Trevor came from a Christian family, I was well connected to his faith. I asked if he had any favorite Bible stories. He told me the whole story of David and Goliath. Suddenly, he became thoughtful. You know, being here is kind of like David and Goliath, except instead it is Trevor and cancer. His dad had tears in his eyes. That is a recent story. Let me have the introductory slides. The reason why I have brought the discussion about Trevor is because I want to say in pediatric care, spirituality and spiritual being has been associated with many good things in the care of children who are hospitalized, children who are suffering pain and the impending end of life issues. And when I had this discussion with Trevor, I came to realize that spirituality is something that is important also to children. And we all need to know that spirituality and spiritual well-being is an important part of a child's life while in the hospital. And World Health Organization, many Christian organizations like what we call American Academy for Pediatric Care have all done a research, and they have found that spiritual care is an important part of pediatric care. The only challenge, before we go to our first to the other slide, the only challenge is that sometimes when we talk about children's spirituality, the tendency is to feel that maybe children might not understand what spirituality is. And sometimes people would say, maybe spirituality is not important for them. But the reality is spirituality is really synonymous with a person's religious life, but it is not synonymous with a person's religious life. That is why most people put a lot of emphasis on, children spirituality around where they go to church, whether they have had an experience of going to a religious place. So sometimes you can find many people saying, okay, this is not important for children. So when we think of spirituality in children, we need to not only think of it as the other aspect of being in an organized religion, but also to think of it as something that deals with relations, how the child sees himself in the world, the meaning, the purpose, and all that goes around it. As I have indicated in this first slide, I've said children's spirituality has a sense of relation to what is other people, sacred other, different sense of themselves. And the greatest foundation for spirituality in children is what I call in theological anthropology, the imago Dei, that all of us bear the image of God. And because we bear the image of God, we have an affinity to look for the ultimate, whether a child or an elderly person, even those who have not had an experience of an organized religious setting, they will always have something that pulls them towards something that is ultimate. And because of that image of God that we are created with. Another aspect that shows the importance of spirituality in children is in the anthropology of the theological anthropology, is the relationship between the three persons in Trinity, the way they relate to one another, speaks of how human beings also relate to each other, the environment, and the ultimate other, the significant other that sometimes we cannot really locate it in our thinking. The next slide. So last time I had some moment to discuss about religion, spiritual, the difference between spiritual and religion. So before I look into what I have written here, I want us to take time, the few individuals, all of us who are here, to have our brother control a moment, and let us discuss what you as an individual perceive as what is spiritual, what is spirituality, or what is something that is spiritual, and what is something that is religious, or religion in definition. What is your view about spirituality and religiosity? Your personal views. Let's have a moment of like 5 minutes to have a discussion on our views of spiritual and what is religious. I'm
Yes,
letting my
share
brother.
our thoughts.
Yeah, they can share their thoughts. Yeah.
We can share our thoughts on the chat box. We'll be reading out that. In the event you may want to make a verbal contribution, it's still open.
Do we have something in the chat box?
I haven't seen a hand yet. Maybe I could give it a trial.
Yeah.
Yeah, you did put it very well, that religion is a organized form of or structure on shared beliefs. Look like what makes me identify with a certain belief system. So whatever faith that I confess or profess, that organized structure is what I'll call religion. But spirituality, more or less, would be, I would say, religion is part of our spirituality because every human being is spiritual. Basically, is what gives me meaning, purpose, and how I experience connectedness with myself, others, and God. Yeah.
Okay. Thank you, Kanyi, Pastor Kanyi. Let's all try. I want us to make this thing interactive because today I'm not taking a lot of your time.
Samuel's hand is up. You can unmute yourself.
Yeah, so thank you so much for the opportunity. Just as my brother has alluded to, religion is more of like an organized group that has got some beliefs shared beliefs. And spiritualities and it defines one's sense of belief, sense of peace and purpose. Thank you.
Another person who can give a try. Thank you, brother. Yeah, a sense of but also
Hello,
make sure that you yeah, okay.
This is Medgar. Hello.
Okay, you continue.
Hello. Yeah, I also have this perspective of religion is a structured way of behavior and belief that people will practice. Then this religion and these practices will lead to someone's development or formation of particular spirituality. For instance, Christians believe in Bible, which is a religion, but now they will lead to the product of Christian spirituality. That's how I perceive it.
Thank you. Thank you. Thank you.
Can I try?
Organize us. Okay, you try.
Yeah, religion is the beliefs we have in terms of our faith. You can belong to any Catholic, Protestant, whatever. And then spirituality for me is that deep connection with God based on your faith. You have that deep connection now with God once you develop your religion. Thank you.
Asante. So, in a nutshell, what I am hearing from all of you is that religion is something that is organized, something that it is something that is organized. It could be something that that was started by somebody, and there are structures and practices, custom, traditions that people practice around it. But you have also said within religion, you can be spiritual, bringing the sense of personal with regard to values and beliefs. So that makes spirituality also part of religion. I also need to ask you another question. Can one be spiritual and not be religious? Well, once we respond to that, we also discuss how do we determine children's spirituality or religiosity based on the story I shared about Trevor and also your experience as people who are either part of religion or come across people who are spiritual and religious every day. So I have given you two assignments, but I want us to take something like another 5 minutes to explore, can one be spiritual and not be religious? Can one be religious and not spiritual? And once we are done with that, let's connect it to children. How can we locate children's spirituality? How do we map out spirituality in children in a world of organized religion and spirituality? Karibuni.
I give it a
You give it a try.
hello.
Yes, we can hear you.
Can I try? Now, is it possible for one to be spiritual without being religious or vis-a-vis? Yes, one can be spiritual, but not even attached to any religion. For instance, you are in a discussion with some youths who says, yes, my father goes or my parents goes to church. But they will tell you, yes, I don't see the need of them being devoted so much to church for a reason of still they go to church, but the way they behave in life varies or is different from what the divinity or what the church speaks about. Now, such a person or such a youth does not belong to any religion, but has a particular belief or has a particular trust in something else. Maybe we can call them pagans or whatever. I don't know. That's how I perceive it. You can still be a religious person, but not belonging to any religion. A spiritual person, but not belonging to any religion. And as well, you can be religious, but not keeping any spirit. Maybe you just go to church to attend and come out and like that. Thank you.
Thank you because of those nice thoughts. Another person?
Yes,
Hello, how are you?
allow me try. Now, can one be spiritual and not religious? That is true. As long as there is life, the fact that one has life, that one alone is spiritual, because life is spiritual right from the point of conception. So you don't have to be, to subscribe to any religion for one to be spiritual. And however, there are those who are religious and are also spiritual. So spirituality is more supreme from my point of view. And it doesn't have to mean like you must have the connection to God. As long as you have the connection and that sense of awareness of life and others, you are spiritual. Thank you.
Thank you. Okay. I hope I'm not locking in somebody.
Yes, I
We
wanted
have
to say
Reverend Dan.
that I wanted to say that everyone is spiritual, but not everyone is religious, and that means that not everyone practices religion, but in every person seeks answers around their existence, and also they want to draw meaning to the situations of life, and so everybody has that aspect, but they may not be practicing religion. So one can be religious, spiritual, not religious. Thank you.
Thank you. Thank you very much. I think we have really captured almost everything that we need to know, that spirituality is universal and it is inclusive. But sometimes there are people who are religious but not spiritual. But sometimes we are both, okay? Because when we speak of spirituality, sometimes it goes beyond, an organized religion. Sometimes somebody has relationship with the ultimate through nature, through self, through music. And it is all built around meaning and purpose in life. So the reason why I brought this discussion is because, as I indicated earlier, I say in children, spirituality is no longer synonymous with aspects of personal religious life, but include many different ways that people may encounter fundamental issues of existence. And often for children, this requires that you need to know what spirituality is. This means it can specifically be hard to think about children's spirituality. We may need to see both spirituality and childhood differently. First, it helps to have a general view about what spirituality entails in children's point of view, because for children generally, they have awareness sensing. When they are here and now, you can find that what they sense even is beyond what an elderly person sees. They can tune to the immediate and to the one that you are not seeing yourself. Yeah? If the child flows, he has some mystery sensing. He has awe and wonder at the same time in his normal space of working. So the reason why I brought this discussion is sometimes we tend to see spirituality more as organized religion and forget that it is beyond that. It's beyond that. So, and I'm happy that we have such good thoughts that can help us understand what we discuss about when we talk about spirituality in an healthcare space. Because the next slide, because as we go to the next slide, when we talk about assessment, screening, and history taking, it is so easy to reduce, it is easy or it is normal for many people to reduce assessment screening to only mean whether somebody is going to church or not going to church. The first time when I went into the file of a patient, I found a tool that had a few questions about spirituality, and it was about what church do you attend? No, yeah. The first question was, do you have a faith? Do you have a religion? The person said yes. What church do you attend? The person said he was a Presbyterian. And that was it. And so I asked myself, what about somebody who doesn't go into an organized religious space? How can we screen and know whether he is spiritual or not? And that is how I ended up coming across what I was taught in by one of my teachers called Buchaski, the Kehpca tool. So before we go to that, so when we talk about screening, general screening gives the basic information, whether the person goes to an organized religion. And then maybe sometimes the second question in screening is, would you like to visit somebody with a, would you like to receive spiritual care? And most of the time people would say no, because in screening, people would easily say, who is this person coming to give me spiritual care? Because most people associate spirituality with their faith, their religious, their organized religion. But when we take this conversation on assessment the next level, to the level of history taking, by using the assessment tools, that is when now we get from a religious mindset to an open mindset where somebody who is both religious and the other one who is not religious can be open to the conversation on spirituality and their situation in healthcare. And that applies to children too. Children, as I indicated through the story of Trevor, children, if I had asked Trevor, do you go to church? The answer would have been immediate. yes, I go to church. But I started first by asking him whether he knows there is somebody called a chaplain. And he said no. So I had to introduce the chaplain by talking about the person that he knows, the pastor. And so when I talked of the chaplain being the pastor in a hospital setting, now he opened up to tell me what is going on in his life, to tell me about his prayer and the conviction that he had, that God had told him that he was the right person to have the sickness, because God knew that he was strong. And that could be the upbringing that he had gone through. He had been prepared for a time of pain and suffering. So when we talk about assessment, we talk about the general screening. When we want to know, who is this person? Does he have a faith? Or is he spiritual, or is he religious? But when we come to the second one, we want to know actually more about his faith. And that is where we have the tools. And one of the tool is Kehpca tool. And then we have another tool called hope, another one that is called fact, another one that is called faith, and another one that is called the open invite mnemonic tool, and also another one that is called spirit. There are many tools that can be used in spiritual history taking and spiritual assessment. Let's go to the next slide. So taking spiritual history allows our clinicians to understand patients fully. Before I go into this discussion, let me say all the tools that are used in healthcare assessment for children and elderly people, all of them were not actually coined by chaplains. Chaplains came later to use these tools, but most of the people who started these tools are medical professionals. Like the Kehpca tool was started by Dr. Puchaski, who teaches in George Washington Institute for Health and Spirituality. So she's the one who came up with the Kehpca tool. Other people came up with the hope tool. The hope tool is based on the resources that a person has when he is sick. Hope means, okay, what resources do you have that you can use? But for Kehpca, the question is faith and belief. F is faith and belief. I is importance. C is community. And A is address. What do we need to address in the person that we are serving? So that is an important tool that is used, that I use, and I think it is the best that I have found, that is even useful for the children when trying to assess their spiritual history and their current status spiritually. So I want us to go to see what F actually means in the spiritual assessment aspect of the child. Faith and belief. This is what I used when I was reaching out to Trevor. I asked the question to Trevor, even though I didn't write it in full. Do you, after I established that he had a relationship with an organized religion, I asked him, is spirituality, is your religious affiliation something important to you? And he said, yes. It means sometimes coming from the point that the child understands. Maybe the child senses that in his life, the parents are important, but there is somebody who is more important than their parents. Because everything in children centers around relationships. And it centers around the most important relationship in his life? Sometimes it is the parent. It depends on their relationship with the parent. If the parent have taken a lot of time with them until they have built trust, when you ask them who is the most important person in your life, they would always say parent. But if when you are using this tool called Kehpca, faith, you ask him, if you have faith in your parent, who do your parents have faith in? And most of the time, children will say, my parents have faith in God. And you ask them too, do you have faith in the same God that your parents have? And most of the time, they would respond in affirmative. So in Kehpca, the first F is about faith and belief. Where do you put your faith? Where do you put your trust? If they don't understand, if they don't have somebody that they have put in trust, you ask the question, what gives you meaning in life? Sometimes they would say family. Sometimes they would say my children that we play together. When they say the children that they play together, you ask them, where do they play? And I got surprised that most children, when they close school, where they play most of the time is in the church or next to a church compound in their community, because that is where the churches are positioned, are close to where people have established their homes. And most of the children will say, I find meaning with friends when we play in the church. And that gives you another opportunity to ask him or her about their faith. So when we talk about Kehpca tool, we are talking about faith and belief. Next slide. Another aspect of Kehpca is importance. What importance does spirituality have in your life? For children, they might not answer this question directly the way I ask, but what you ask them is, how much value do they put in what they do in church? Because what they do in church sometimes is the spiritual expression of their faith. So you reframe the importance to what they do, either when they are playing, because in the mystery making aspect of children, or the all sensing aspect of children, it is easy for children to sing songs that are sung in church, or even songs that they have heard being sung in radio. And most of the songs that are sung in radio, sometimes it is about Jesus who came to die. And when you ask questions around the importance of what they do in relation to their faith, most of the time the children will respond very well. For example, you can still ask as your spiritual, as the singing that you do, or the play that you do, the hide and seek around Jesus who is looking for the lost. Is it important at this time when they are sick? And most of the time, most children will respond in the affirmative. Am I still with all of you? Next slide.
Yes.
The other aspect of Kehpca is community. This is now when the children can give you different answers. Most of the time when we talk about community and children, they would not, most of the time they will associate themselves with where they go to church. But they'll also tell you they have other communities around them, like family, like the neighborhood, the children who play with them. That would be very important for them at that time. And they'll tell you, I miss, when you ask them about community, you also need to know if they appreciate or they miss the community they are part of. And most of the time they will tell you, I miss the children we play with. And if you have to locate their spirituality in that community, is ask them if those children that they play with are the same children that they go to church together with him. And most of the time they would say, I have two friends whom we go to church together, and they visit once in a while to be part of what they do in the community. Another slide. The other important aspect of Vika tool is address in care. How would you want me or your healthcare provider to address these issues in your healthcare? In the discussion that I have tried to bring in with Vika, FIC, it is a tool that helps you to assess the child. Once you know the faith, whether it's spiritual or religious, or they have said that they are part of an organized religion, you ask them, how does his faith help him deal with the current medical challenge that he's going through? And most of the time, those children, especially those who are adolescent, they'll tell you, when I sing, I feel I have peace. And then you ask that child or that adolescent or that teenager who is maybe at the age of 9 to 13 or 14, you ask, now that you are sick, and when you hear people sing, or when you sing a certain hymn or a certain chorus, you feel that you get peace. So you ask him, how do you feel right now? Do you have peace? Or are you anxious? That is when you are able to engage the child on the challenges that he's going through during the period of sickness. And now you have identified that faith is important for him to have peace. So you come in the second aspect, the importance of that faith. So you ask, what are we going to do to support you in your faith as an hospital during this time? And what community should we bring around you? Sometimes they can tell you he or she wants to see the children that they play with. Sometimes they will tell you, I would want to have my Sunday school visit me. So as you go through this tool, you come up with a plan of care, a spiritual intervention that will be needed for the child. So that is why the last bit of FICA is address in care. How would you want me or your healthcare provider to address these issues in your healthcare? And sometimes they would say, I want the doctor to continue to give me medicine, but I want my pastor or the children that I go to Sunday school with, or my Sunday school teacher, to visit me. Or they would say, chaplain, I would want you to be the person to be praying for me every day. And out of this, you will have times to sit with a child and talk about many things dealing with this current life and the challenges that have to come in future ahead of him as he continues to face the challenge of disease. The other slide. So I have tried to build this discussion on Vika, but I know there are other tools that can be used, like Hope. They also provide a way of doing an assessment. But in my practice, I prefer using Vika because in Vika you are able to build. I have used it, and I'm able to integrate my faith and the faith of the child around it as I continue to have the assessment. So in other words, what I'm saying, in spiritual assessment in children, there are several questions that should be explored in general. Like, have you known someone or a pet? Maybe if you are dealing with death, there are aspects in spiritual assessment that is not easy to handle in children, like death. And so if you are dealing with an issue of death and you want to discuss about the end of life care of that child, so you have to ask yourself, you have to ask the question, have you known someone or a pet that has died? How did you feel? When someone dies, where do they go? You now want to discuss issues of meaning, purpose, and destiny. What do they find when they die? What are your worries? What are your hopes? So this is one way of communicating death and the story behind end of life care. And then you would also ask, how can I, if such a thing come to you in life, how do you want us to help you? And it is not an easy conversation for children, and even the person who handles children. The other slide. And now that the child is sick, you can ask, what has it been like for you? Since the time, like the way I was asking Trevor, since the time he got sick, how has life been? In fact, the question that he said he had prayed to God and God had told him the reason why he's sick and he's going to get well is because God knew that he was strong. I had asked him, what has this been? How has life been? How have you been dealing with the challenge of disease? And he said, God has talked to me, and I know this is something for a short time. Another important aspect when dealing with children is that you need to review the child's hope, dreams, values, meaningful life, and role of prayer and rituals in beliefs. You can use questions like, who or what makes you feel safe? Who or what is closest to your heart? What makes you happy, sad, or frightened? Next slide. Okay, you remember the case I brought in last time? I want us to do it today again, but now I want us to do a spiritual assessment using the Kehpca tool, and you are the ones to do it. And it is a case that handled a religious challenge that is often found in hospitals. A child with hyperseleninism and recurrent anemia for 5 years was admitted. Mother and other church members who accompanied the mother declined blood transfusion despite intensive counseling and consultation. Child was at the point of death and had no autonomy to make a decision. Mother had so far lost 2 children due to anemia and is not willing to change her mind. What would you do? But the question now is not what would you do? Please do a spiritual assessment of this child. And in this spiritual assessment, you need to identify the religious background. You need to identify the struggles of the child. You need to identify what can be done using the Kehpca tool. Brother Kanyi, you are the leader to lead us as we do this assessment.
Yes. It's an open question, and I'm seeing with us we have even other chaplains. We can contribute to the case study and come up with a assessment or diagnosis of spiritual distress.
Yeah, the diagnosis, the spiritual distress, all that. It's not a must that you should use Kehpca. If you use hope If you use the other faith tool, we can use all that so that we come up with. We can ask ourselves questions. We begin with F, faith and belief. So what about the faith and belief?
When it's not indicated, I want to pick up on that the church doesn't allow blood transfusion.
Yeah. Pardon?
I'm saying, well, we don't have a name of the faith or the faith background, but I'm able to pick that the church, one of the beliefs in the church is that they don't allow blood transfusion.
Yeah, one of the beliefs in the church is that they don't allow blood transfusion. Is it okay if we identify the faith using the blood transfusion refusal? Let's identify it's a religious organization that declines blood transfusion. What organized religion is that? What is the name? JW, sivyo?
Yes.
Mnajua JW.
Yeah.
So that is faith and belief, sivyo? We already know that they come from a religious organization that doesn't allow blood transfusion, and the denomination, we already know it. Aya, what is the next thing? What is important in the life of this child at this time? The Vicar tool. What is important? I thought you said there are chaplains here. Yeah. What is important?
Yeah, I can see a number.
You can see a number. When we talk of importance, is what importance does spirituality have in the life of that child? Now that you can see that he goes to, yeah, he is affiliated to some faith. Isn't it important? Does your spirituality influence you in your decision making? For
It
them,
does.
spirituality, yeah, it does. Yeah, it influences that they don't need to have blood transfusion. That is their faith. It's important. So Vicar 2, 1, they have a faith. 2, religious spirituality or religious aspect is important. It influences decisions about whether to have blood transfusion or not. And in this case, the child is supposed to get blood transfusion. But now the faith is an embedment. But for them, it is not an embedment. It is their belief. How do we deal with it? We are in a dilemma.
Rogers, your hand is up. You can unmute yourself and make the contribution, please.
Hello, I don't know whether I'm clear.
Yes, you are.
Yeah, clearly, I think under FICA tool, the second one was the impotence, and clearly we can see that the beliefs, their beliefs, and the community, what their belief has greatly influenced decision making. So they are declining blood transfusion, despite the fact that she has lost 2 children in the past due to anemia, and for us to come up with this solution, we probably need to give it an approach of also involving the church, because the church has great influence. So it's very important. It has influenced decision making for the mother.
Yeah, thank you, brother. So can we go to C? I think you have also mentioned the C, isn't it? Community. Ama mnaonaje?
Yeah.
Maybe.
My intention actually is showing how the tool can work, that it is possible to use this tool and come up with how to handle a family, the child and the family. It is possible. So what about the C? Let's go to the C and then the A, and I think we will be done. Ndugu Kanye.
Yes.
Can we go to the C? Our brother has
Community.
mentioned, yeah, community. Is that community of support to the child? Or are they important? I can see they have accompanied the mother to the hospital, isn't it?
Yes.
So they are important. What about A? Addressing care. So what are we addressing? Now we have done the tool. What will we be addressing? What is the need of this child? Having done what is the spiritual need, and what is the spiritual, what can spirituality do to help in the intervention of taking care of this child? The address in care.
I am met with a dilemma because the child is not able to make a decision on their own, because what is critical to the church is the sustenance of their life at this critical point.
Yeah.
And the child is not able to make that decision on himself, on themselves.
Mm-hmm.
So I'm just caught in between on how we'll be addressing that now that it's a decision to be determined by the mother and the other, church members.
Yeah, it is a religious need. So how can we overcome the religious need to offer the medical intervention?
I would approach it from a point of education.
Okay.
That life is absolute, given by God, and only Him who has that ability to take it up. We are stewards of that very life, and so we should work towards sustaining that life and helping them understand that the medical intervention as just part of the interventions that we can make. It's still that the medical interventions and the science itself comes in as one of the many gifts that God has provided, which we can use to sustain that life. So we'll be having that conversation around that.
Thank you, Kanye.
We have Sophia. I think you can unmute yourself also and make a contribution.
Thank you. Number one, I'd wear the shoe of a mother as a mother. And first, congratulate her for the first 2 children she gave birth to. And let her acknowledge that these kids were given to her by God, the creation story. So we appreciate God for the first 2 children as much as God took them away. Then I bring the aspect of hope. Even this 3rd child, it is still God who gave you this child. So can we trust in God? Let us have hope that this child is going to be fine. And if it is the will of God, let the will of God do what? Be done. Because at times we get patient asking us, how many days do I have? So we cannot even quantify the days of the kids, of the patient, determining the timeline of their life. So we tell them, it could be one day to God is 10 years. It could be 10 years, then it can be the next 10 minutes. So I'll just start by giving her hope and telling her, you have done a good job. You're a mother. You already had 2 children. This is the 3rd child. Don't worry. The child is from God. Let the will of God be done. So we just walk step by step. By the time the child maybe will have baby to die, the mother will have been prepared spiritually. Thank you.
Thank you. What about the medical intervention that they are refusing because of that community, that faith, that community? And how do we address it as a spiritual care team who have done the assessment? They already know the religious background. It means at that time going back to know in these JW people what is acceptable in terms of what is acceptable in blood transfusion and what is not acceptable. Yeah, because it's a religious dilemma that is hindering a medical intervention. Yes, we can prepare them to be prepared for the child to die. But can we also prepare them on the possibility of the child being alive if they only accept blood transfusion and understand what it means to transfuse blood? Even though they are religious faith, they don't accept it. Anyway, have you come across such a case? Where people decline blood transfusion? Maybe Nairobi Hospital, my brother Kanye.
So may I come in?
Yeah.
I'm from Kehpca. And yes, these are issues that come up in the process of care. Mostly, I know they end up in the hospital ethics committee,
Ethics team.
which we have chaplains represented there.
Yeah. Up to that point, I think I am done.
Samuel, you got your hand raised up. You can unmute yourself.
Yes, I just wanted to maybe give a different opinion because such cases are very rampant. So if you remember, even in the Bible itself, there's a point that Jesus had to crack the whip and kill people in the temple. So me, I will not take the of soft persuasion because if you do that, then these cases will continue popping up. So I will crack the whip, confront, because confrontational is one of the ways of solving such kind of things. And I will ask myself, what was will the religious movement do in case the child's life is saved? Thank you.
Yeah.
Thank you, Samuel.
Samuel.
And we have Dr. Wega as well lined up to make a contribution. You can unmute yourself, Dr. Wega.
Okay. For me, I just want to take where Kanya has left and also look at the mother, their church members being part of the community, but also where this mother comes from. As a mother, I know just like one who has said she could wear the shoe of a mother and a child. First of all, I would like to address the mother away from the members of the church. Also to see her views on the same through the education which Kanye mentioned. One thing here, she needs to be, I need to convince her reasonably and realistically when it comes to preservation of life. This life is God-given. And therefore, as a mother, you have a task to preserve the same life. And when preserving the same life, the church will have a member, but the church cannot have a member when somebody has died. The mother, you'll have a child if the child survives. So I would like to, first of all, also to draw the mother to see the life of the child from her own eyes and her own perspective before she brings in what would the church or what would the community would see her as violating the beliefs of our religion. And through that, I'll be helping her now to reason from our own, other than from perspective of what will others see me. Because after all, she is the one who God gave this child. She's the one who takes care of this child. What is your responsibility when you reach to such a stage? So I would like to listen with her from that perspective, because I would also to know whether, from her own perspective, what are her fears if she allows, even if this is what belief, but this is the situation I am in. And I won't go up to, I will follow that route myself.
Thank you, Dr. Wega. Reverend Mary, we can take a final one from Reverend Washira. Reverend Washira, you can unmute yourself.
Thank you very much. I think as Dr. Wega says, I think I'll follow the same kind of a thing, because as much as this lady subscribes to a religion which a set of beliefs, I think what makes meaning to her is the life of the child. And I would want to explain to her exactly what blood transfusion means, so that she's informed. And from there, she can choose from a point of information, because some of the religious beliefs are not based on facts. And sometimes they have a lot of, they're actually not anchored in anything. And so I would go to a step of explaining, and also trying to bring the meaning of the importance of the child to live. And I think this woman would attach more importance to that than to her religious belief. And I think with that, I would hope that she would be able to understand, because I've seen some patients who refuse to go through some assessment or procedures because they have fears, and the fears are real until someone comes in to explain. And I know you know a case in mind where a patient says no, but it's based on misinformation. So I'd try to correct that distortion of information, and allow the mother to make an informed decision. Thank you.
Back to you, Reverend Mary. Reverend Mary.
Okay, what I'm saying is, thank you. I didn't know I was mute. What I'm saying is that I want to appreciate the contribution that we have made in that assessment, and the view of the address in care, the fact that we should focus more on the value of life. Because if you focus on the religious aspect of this mother and the church members, you will not take a step even in the conversation. But when you focus on the value of life, even especially knowing that they have lost 2 lives already, you can make some steps. Another important aspect that I recommend is the reason why assessment tools are important is because it is able to help us locate the spirituality or the religiosity of the people we serve. It helps you locate them and know what they know, so that you can know how to face them. One example of such aspects is sometimes you get to know the religious background of the person. I have had an opportunity to deal with those who refuse to eat because they are preparing to die. You know the case. It's a common case in this country. So these spiritual assessment tools are really important, and it helps every spiritual care practitioner be able to locate and know what to do at a given time. Some of the solutions are ethical, like the refusal of blood transfusion. It is an ethical thing. It goes to the ethics committee, where the chaplain is, and there are many decisions that will be made on behalf of the child because of the refusal of the parent. But the most important aspect is locating first the spiritual distress of the child and the spiritual challenges that the child is facing that is an hindrance to the decisions that have to be made. So thank you because of that opportunity to have a discussion. So let me say, healthcare settings are generally multi-ethnic and multi-faith environment. So palliative care commands knowledge and respect of individual value system, beliefs, family structure, religion, ethnic roots, and cultural norms, as well as a group of cultural practices. So understanding these things can really help you explore and know how to respond. Because at the end of the day, we should respond in preparing them to face end of life, but also to get the quality of care that they need to get. Respecting beliefs, customs, and tradition with a focus on preserving the integrity and sanctity of the parent-child relationship is of utmost importance in pediatric palliative care. So God bless you very much. Thank you for giving me that opportunity to take you through this. It is a small part of the many things that can be discussed, but God giving us time, we will have more discussion. Asanteni sana. God bless you.
Thank you so much, our great facilitator, Reverend Mary. Indeed, those were quite deep insights and also reflections. And thank you for making us also participate in the presentation. I'm sure we've learned, because these are things we meet as we practice in our various levels as professionals. And as we bring this to an end, if you could be having a burning question, you can put to that on the chat, and we'll be able to respond to that. And I'm just trying to pick up a few reactions that we had. This was during the case study presentation, and Kennedy had asked, were the two children who had died out of the transfusions? I think it's an exploration question just to trace whether the fear or denial to undertake that is coming from as a result of a past experience. I believe that's what Kennedy was asking. And
yeah, they seem to have been having the same problem, anemic. So, you know, that is history that was got with the conversation with the mother and the church, that this is not the first time this mother is losing a child, you know, from in such a way. Having a child with anemia and the challenges like that. So it is something that a chaplain gets out of the conversation, out of the vicar process. Yeah, so it's true. That is what came out.
okay, thank you. And we are also having reactions, people saying it was a great session and I have learned. This is from Catherine, requesting if we can have the slide shared. I'm sure Kehpca can be able to help in that. And we also have a reaction here on someone asking, Reverend, how do you handle God's will, considering that the first children may have died from a preventable or treatable cause?
Yeah, you are also a theologian. How do you handle God's will? And how do you determine that this is God's will? Or is it sometimes we can say God does allow death to occur, even when our religious beliefs are an entrance to not God's will, which is healing, to be done. because maybe if this child had been given an opportunity to have blood transfusion, maybe that could be the correction. But if it was something that was caused by the bone marrow, and then there is the challenge of blood not being manufactured in the bone marrow, and then issues of platelets and all that, the conversation is big. How do we deal with, I am a chaplain that deals with end of life care, stage 4 cancer, illnesses that have no cure, known cure, but they can be managed, and somebody can live with it for some times, for some years, So sometimes, which death do you say is God's will? Which one is not God's will? Which one is accidental? It is a conversation between you as a theologian, and also between the person and God and his faith. So I cannot give an answer outright, but it is that intersection of dealing with end of life and life itself and medical interventions.
Thank you, Reverend Mary. Indeed, that's so true. It's more about processing on what is the patient's experience. And I'm sure in our African perspective, sometimes even talking about death is going to be a little bit of a tricky thing. And so dealing with these issues is conversations and several visits really that have to be done to support the patient through acceptance really, and being at a comfortable place to face their own mortality. Yeah. Thank you so much. I see no other reaction, and so we want to bring this to an end. Maybe Kehpca can be able to organize for another one, because the case study you presented has also a dimension for ethical dilemma. We could also maybe explore on the role of chaplains in clinical ethical dilemmas. Yes.
Yes.
Yeah. Yeah, so that's something that can be picked up, and we have a conversation around that. And it's so great to have all of you who are able to attend. We were quite almost close to 100, and we really hope that we have also been able to benefit from this. And we hope that we will be tuned in for the next series that will be on the offing. And let's continue with the conversation. Kehpca will be able to arrange to see whether we can have the slides on emails. I hope we did provide our emails. And so if there is no further ado, we can be able to bring this to a close and leave at our own pleasure. Thank you, everyone.